Hi there, welcome to What's on Your Counter Wednesday. I'm Sasha. I'm a medical esthetician at MedSpa 1064 in Glastonbury, Connecticut. This series is being inspired by our clients who are always asking us what we do for our own skin. Working in a medical facility, we have the best of everything available to us at our fingertips, as well as being constantly offered new products from all different companies from around the world to try and see what we think. So most of us have kind of a favorite base routine that we like of products that we know work really well for our skin. And then in between that, we're also testing out products that might become favorites. So right now I'm going to show you my morning routine. We posted this on Instagram last week. It showed you a photo of my morning routine and then my evening routine. So this video will show you my morning routine and give you an idea of what I do and the time it takes. There are a lot of products, but once you get used to it, it's a very simple routine. So I'm going to go through that right now. First, I take a shower in the morning. I do use my Clarisonic brush. Huge fan of the Clarisonics. It has a 1-minute timer. So once you click it on, it goes for 1 minute and then it shuts itself off. That way you're cleansing for the exact optimum amount of time. I use a vitamin C cleanser. This is from Obagi. It's from their CRX line. I put a tiny bit of this on my Clarisonic. I do 1 minute on my face and then I click the button again and I do another minute on neck and chest in the shower. Once again, these are really good tools. They're completely waterproof, so you can use them in the shower. Then I use it again at night for my evening routine just at the sink. Then after I get out of the shower, I like to use a toner. So these are really nice. They're from our MedSpa 1064 line, and these are pre-moistened. These are referred to as brightening toner pads. So we'll just take one of these and give it a quick swipe on dry skin. And this really helps to adjust the pH of the skin so that it will better accept the next product that you put on. So I love these pre-moistened pads just because they're so convenient. You don't have to go looking for cotton pads. These are ready to go. Then I'm on to my eyes. So I really enjoyed this Obagi product. It's from their Elastoderm line. It's an eye serum. I use this in the morning. It's a roller ball. You can see that it has that nice metal tip. And that helps to massage the tissue as it dispenses the serum. So I start at the corner of the eye and I work my way in the lower eye and then right over the eyelid as well. And you can feel the product coming out. It's nice and cooling. And again, the little circles help to massage the tissue, which will reduce puffiness. And once that's applied, I take my ring fingers and I tap it in. That's a great skincare tip, is to always use your ring fingers or your middle fingers when you're doing things around your eyes, applying eye cream, applying a serum like this. They're your least strong fingers so that you don't pull or tug on that delicate tissue. So I can feel it's getting kind of tacky, which is what I want. That means it's absorbing. Then my next step is a serum. So again, from the Obagi CRX line, this is a vitamin C serum. L-ascorbic acid is the active ingredient in this, as well as hydroquinone. So this has a 4% hydroquinone, which makes it prescription strength. I do about 4 drops of this. Everybody kind of has an optimum between 3 and 5 drops. For me, it's 4. I work it into my hands just to warm it up, and then I apply. I like to do serums in kind of a patting motion just so that it really starts to absorb. And it's very lightweight, feels great on the skin. This comes in 2 formulas. I use the normal to dry, which does have a slightly oily finish and adds some moisture to the skin. But it also comes in a normal to oily formula, which is great if you're acne prone or just have more oily skin type. Do a little tiny bit on the neck for what's left on my hands, and then also across the décolleté. And you can see I'm getting a little pink. That's normal for me. Then the next thing I like to use is also from the CRX line from Obagi, and this is a vitamin C exfoliating day lotion. This pairs really nicely with the serum I just used. So I'm going to apply a little bit of this, just a tiny bit right on top. And this is more of a lotion texture. This does have some alpha hydroxy acids in it, so it has a nice smoothing benefit. And I also feel a tiny bit of tingle when I apply this. I'll also get a little pink from that. Again, perfectly normal for my skin. it goes away in just a few minutes. And then once again, up the neck and across the décolleté. I apply product to those areas last because that way most of the product is actually going onto my face and less onto the neck and chest because we don't want to put too much product here. This area is much more sensitive. And then I also add the Elastoderm eye cream. So this same active ingredients that are in the rollerball with the peptide complex, but this also has some hydration in it. So tiny bit, a little bit of this Elastoderm goes a long way. A jar like this should last you about 6 to 8 months, and that's using it twice a day. So tiny bit, again, on that middle finger, and then just tap and apply. The great thing about Elastoderm is it's designed to go on top of the eyelids. So a lot of eye creams will say avoid the lid, but Elastoderm is great for preventing hooding and helping to, again, refine the texture. Gets rid of that creepy under eye. And then lastly, I apply my SPF. So a really important step that should be applied every day, no matter what, whether you're going to the beach, whether you're going to work, whether you're driving around running errands, SPF is really important to protect yourself every day. This is our Med Spa brand. It's called Silkshade, and it has a little bit of a tint to it, which I really like. It gives a little bit of coverage, and I like to mix this. This is a really nice gel-based formula and has a very matte finish. And I mix it with the Jane Iredale Dream Tint. So this is a tinted moisturizer from our makeup line, Jane Iredale. This is a really nice one, has an SPF 15, and then the Silkshade has an SPF 30. So I'm getting really good SPF coverage, mixing these two together, and it just gives a really nice finish. It's not too matte, it's not too dewy, and it goes beautifully under mineral powder. So I just apply this. Again, just getting full coverage on the face, into the eyebrows, across the lids. Remember, this is your protective barrier against UV damage, environmental pollutants, and also creating a really nice base to put my powder on top. And that's it. So now I'm ready to put my makeup on and start the day. Thanks for joining me, and I look forward to seeing you on the next edition of What's on Your Counter Wednesday. Take care.